have been having babies for a very long time, and for almost as long, there have been myths out there about being pregnant. Dr. Agee is also an author and here to debunk some of those myths that some expectant moms have. All right, first let's break it down. What are the biggest myths out there?
I think one of the biggest myths is that during the last trimester, women need to just sit on the couch, put their feet up, and one of the things that happens with that is it actually gets the baby in the not a great position in the womb, and that can cause back pain, and it can cause pressure, and it can also cause difficulties during birth. So it's actually best for women to go ahead and sit in straight back chairs with their feet on the ground and to get some exercise like walking, swimming, prenatal yoga.
That sounds so uncomfortable. Sit up, you're like, I am so miserable, I'm ready to have this baby, but you're telling everyone at home, even though they're miserable and uncomfortable, they'll actually be more uncomfortable if they sit in that comfy couch.
Well, and so what they can do, because it really is important to relax, of course, and so what they can do to relax is to lie on their left side with a pillow in between their knees and take it easy that way. But part of the time be sitting up straight, and it just lets everything get in the right position in the womb.
I love those full body pillows that are for pregnant ladies. They're
fantastic.
The best.
Yeah, that's actually a full body pillow would be wonderful for this.
You like cuddle up to it. All right. Well, April is National Cesarean Awareness Month. Are there any myths tied to cesareans?
You know, I think there are. These days, a lot of people think cesareans actually are going to be easier and less painful. And, you know, of course, cesareans, when needed, are so important because they can be lifesavers, right? But we have the highest rate of cesarean sections in the world at 34% these days. And so now, really, what happens is, even though women are sedated during the birth, it is major surgery, and it often, there's more pain afterwards when they're trying to take care of their newborn and while they're in recovery.
But every pregnant lady out there should research cesarean. I had a cesarean, but I was like, oh yeah, I'll have a natural birth, so I wasn't prepared. So go get those books, like your book right here, Uterine Health Companion, which is fantastic. Okay, you mentioned prenatal yoga and relaxing.
Yes.
Let's bring in a demonstrator, Kathleen,
great,
to help us out on some great poses. Hello, and you obviously not pregnant. So if you could show us some moves for us, what is she going to demonstrate?
So she's going to demonstrate the cat and cow pose, and these are really simple yoga poses that literally help the baby get in the best position in the womb. So the mom will feel great during the last trimester and throughout yoga, and also have an easier time during birth. And she's also going to demonstrate a couple of modified squats. And the first is for the first trimester, where women can actually go deeper in to the squat and whatever feels right to them. Then in the second trimester, you're just going to want to make sure you come up a little bit more because that's going to be more comfortable. Then same thing in the third trimester, just come up a little bit further because at that point you're bigger. And you can also, if you're doing this at home, you can brace yourself on a chair or up against the wall during the third trimester if that's best.
Should pregnant women listen to their bodies, especially when doing yoga?
Yes, yes. And always listen to your body, talk to your healthcare provider, do what's best for you, definitely.
And then you recommend using some pillows, especially not being flat on your back. You talked about laying on your left side.
Exactly.
Is that the same for prenatal yoga?
Totally, because before in yoga, a lot of people for relaxation do the relaxation on the back, the shavasana. During pregnancy, you want to do it on your left side with a bolster, with a pillow, and just make sure you take good care of yourself and listen to your body.
And then you'll recover after pregnancy much more quickly if you do those things. You pay attention to your body during pregnancy.
Oh, completely. And you'll get to have a much funner time with your newborn.
Exactly, exactly. Now you're doing a teleseminar next month with more great information for folks out there and expectant moms. We'll have all the information people need to know on our website, kclive.tv. Also, the dads out there, they can learn as well.
Completely. They can have a wonderful time during this.
Fantastic. Thanks for stopping by. We appreciate it. Let's check in with Michael.